Welcome everyone. Thank you for joining today's webinar, Business Considerations and Workplace Safety During the Pandemic. I'm Jeremy Thiel. I'm the Senior Manager of Marketing Ideas and Education with DriverCheck, and I'm going to be your moderator today. So just some housekeeping items as we get started here. Please note that everyone's on mute, but we will field questions at the end of Jonathan's presentation today. But you can ask them at any point during the webinar by using the Q&A icon located at the bottom of your screen. So if any thoughts come to your head, type it in there and we'll get to as many as we can by the end of the session. And whatever questions we can't field today, Jonathan will be having written explanations for all the questions that we field, and we'll be circulating that post-event probably sometime next week. And as this is a webinar, usually there are some sort of technical difficulties. So majority of those from your end can be addressed by using the up arrow or chevron icon that's in the bottom left-hand side of your screen. And from there, you'll be able to select your proper microphones and adjust your volume, etc. So, and this is a reminder that the presentation is being recorded, and we'll make these the video available post-event as well. So with all that being said, let's get to the exciting good stuff while everyone's here. So first off, I'm honored to be the one to introduce our guest speaker for today, Dr. Jonathan Davids. If I could get his name right, that'd be helpful. He is DriverCheck's Corporate Medical Director. He's also an occupational medicine physician. And since the pandemic began in March 2020, I know it's already been almost 2 years, Jonathan's been at the forefront for all of DriverCheck's activities in response to COVID-19. He's published guidance documents, he's conducted educational webinars for employers on COVID and how to prepare for return to work after lockdowns, COVID testing strategies, and even vaccine considerations. So with that, I'd like to welcome Jonathan to today's webinar and pass it over to him.
Thanks for the introduction, Jeremy. Hello, everyone. Thank you for joining me today for our webinar. As Jeremy said, I'm Jonathan Davids. I'm an occupational medicine physician and the Corporate Medical Director with DriverCheck. It's a pleasure to be putting on this talk for all of you today. Many of you might know DriverCheck in the alcohol and drug testing space. We're leaders over there, but we also offer a full suite of occupational health services from pre-employment medicals and regulated medical surveillance screening all the way to occupational medicine consulting for about our 6,500 clients across the country. In addition to that, as Jeremy said, we've been involved in COVID services since the pandemic began almost 2 years ago, just helping our clients keep their business operations and their workers and workplaces safe. So we've developed a lot of safety protocols and testing strategies, and we've facilitated vaccinations for a number of our clients. I come to you with a little bit of experience from on the ground. I think we've done about over 600,000 tests and vaccinations on top of that. And we've got a business-to-business and a business-to-consumer approach to delivering rapid testing kits. So we've been in the space and we've been doing a lot of it. So I come to you with a little bit of experience in how this is sort of unfolding on the ground for a lot of employers, individuals, communities across the country. I do want to start off with a couple of disclaimers, though. I'm not an infectious disease specialist or a virologist, so I am an occupational medicine physician. And for those of you who are unfamiliar with that, it's really a preventative medicine discipline. We manage sort of health and well-being of workers and any exposures that they have in the workplace, including infectious diseases like COVID-19. With all that being said, I think let's get on with this. I want to sort of spend a bit of time going over a number of things, specifically just a quick recap on where we've been, and then talk a little bit about present state, where the Omicron variant is having an impact on business operations and what we're doing. That will sort of lead generally to talk a little bit about vaccinations and boosters and the effectiveness of that. And then more importantly, how to sort of mitigate some of these risks with using rapid antigen tests, how effective they are, some of the changes that have been recommended for swabbing and how to get a proper sample. And then we'll talk briefly about some workplace rules and regulations and best practices, and then perhaps finish off on some lessons learned, and then we'll open it up to a Q&A session. So as Jeremy said, do put that in the Q&A box and we'll get to as many as we possibly can this morning. So just to level set our understanding of this virus, I do want to outline how SARS-CoV-2, this is the name of the virus that causes COVID, how that infects our bodies. As we all know by now, SARS-CoV-2 is mainly spread by human-to-human contact through respiratory droplets when an infected person coughs, sneezes, talks, shouts, sings. And if you're within that 2-meter space of them, and you could potentially get exposed to that. We also have good evidence that the virus is sometimes spread through microdroplets or aerosols, which linger in the air unless we have good ventilation. This is why being outdoors significantly lessens the transmission risk, and being indoors in closed, crowded spaces carries a very high risk for getting infected. But regardless of what variants we're talking about, whether it's alpha, beta, gamma, delta, or Omicron, COVID-19 is transmitted in pretty much exactly the same way. So it infects our bodies through our nose and mouth, and primarily infects our throat and lungs, which is our respiratory system. But it's also known to affect a whole host of other parts of our bodies. Certainly cardiac abnormalities, blood clots, strokes, seizures, and long-lasting symptoms extending over months from the initial infection, which we've now come to call long COVID, have been part of this disease. And again, the best way to avoid this infection, as we found out, is to put as many things between that infectious source and yourself. Things like distance, masks, physical barriers, and plexiglass dividers, time, and other preventative measures like vaccines all tend to help. But all these mitigation measures are imperfect. Again, here you have sort of the Swiss cheese model illustrating this point. Some of you might have seen this before, but the concept here is that you have to put many things between the infection source and yourself, and those things like distancing or masking, each one of those things are imperfect and they have gaps. That's represented by the holes in the Swiss cheese, but by stacking the layers one on the other, it's less likely that that hazard, in this case, the virus, would find its way through all those gaps and infect us, because those gaps don't typically line up perfectly. So multiple layers provide better protection than any single layer could by itself. I do want to point out, though, that all of these measures are very effective. Distancing, masking, symptom screening, staying at home when you're sick all work, but businesses need to put policies in place to promote these measures for them to actually be effective. Disincentivizing employees from coming into work when sick requires that employers have paid sick time for their employees. Having an indoor masking policy requires providing employees with a suitable supply of effective masks and enforcing their proper use. Keeping asymptomatic workers from attending work may require an asymptomatic screening surveillance program with a ready supply of rapid antigen testing. And maximizing sort of a healthy workforce means supporting all of these public health measures, including vaccines that we have available to us. So, we'll talk a little bit more about vaccines in a bit, but let's first chat about the current threat. So Omicron and the new kid on the block, the subvariant BA.2, as they are impacting business operations. So the Omicron variant of concern was first reported by the WHO at the end of November of last year, and it's gone on to cause a significant fifth wave worldwide. Here in this slide, we see the fifth wave seen in Canada, with a significant increase in case counts compared to the otherwise devastating second, third, and fourth waves earlier in 2021. Now, the fifth wave continues, but it's seen its peak in mid-January and is tending to tail off, which is potentially good news. And so we'll get to some of that in a second. But what we know about Omicron is that, this variant of concern was first identified in South Africa in November of 2021, and then it had this spread across the globe that was crazy. It's highly transmissible. It multiplies about 70 times faster in our bodies than the Delta variant did. It's 2 to 4 times more infectious, and primarily multiplies in the breathing tubes, the bronchi, not in the deep lung tissue. So this is responsible for us seeing more of a COVID bronchitis rather than a COVID pneumonia, which is what we saw with all the previous strains. And this is one of the reasons why we think it's less severe. It's not affecting the deep lungs. It's more in the mid to upper airways. And now, since that happened in November, it is the dominant strain across the country. And unfortunately, the non-mRNA vaccines don't seem to provide a whole lot of protection against that. Omicron, we also know that Omicron has spread faster than Delta in our communities. The unvaccinated are at very high risk of getting an infection. Vaccinated individuals are protected from infection compared to the unvaccinated, but not as good as we were against Delta in some of the previous ancestral strains. So, 2 doses of an mRNA vaccine will give you about 50 to 60% protection. However, if you get a third dose, a booster dose, that boosts your protection up to between 70 and 90% against Omicron. So still got some good relief from vaccines against the new and emerging threat. The other part of it is that anyone with Omicron infection will likely spread it to others, even if they are vaccinated or don't have symptoms. So, it's important that we still, that we don't rely entirely on vaccinations, that we actually look to other preventative measures when we're thinking about how to minimize our risk. So a little bit about the severity of illness. So Omicron, like I said, is less severe than Delta comparatively, but it's still not a mild disease, especially for a large proportion of the unvaccinated and vulnerable individuals, because we're still seeing increases in hospitalizations and ICU admissions, and certainly saw that in the peak. Now, those two metrics are trailing off as well, which is also good news. But we saw that initially, and if it didn't sort of cause you to get really, really sick, then we also saw that causing people to be absent from work. Previously infected individuals don't seem to be protected, and they can get reinfected with Omicron unless they have vaccination with an mRNA vaccine. And certainly, we also know that breakthrough infections in vaccinated individuals can happen, but less so if they've got that third dose with the mRNA vaccine. So, I've stolen this graphic from the Ontario Science Table. The reference is down at the bottom of the slide here, but this just really shows the outcomes of vaccinated versus unvaccinated populations for hospitalizations and ICU admissions. The bottom blue line in both the left and the right graphs represent the vaccinated population, while the orange line represents the unvaccinated. You can see the disparity over there. We see a high rate of hospitalizations and ICU admissions towards the end of January. And again, that's tailing off. So again, the results of these significant number of infections, if it didn't result in severe outcomes, it did significantly affect the labor force, at least for a short time. And it caused significant staffing issues across all sectors. Maybe you've experienced this in your organization, but I'll tell you, at DriverCheck, when we were delivering our COVID services, when we were doing our COVID tests and vaccinations, we certainly felt this with staffing shortages and had to sort of manage through that as well. What do we do with this? The good news is that some of this labor shortage was actually mitigated by all the stuff that we had done before. So with vaccines being available and with a large proportion of our population getting vaccinated, although they weren't quite as effective against Omicron compared to Delta, it still held up and still prevented serious health outcomes, especially amongst those who had their booster shot. So, the booster is very protective, certainly better if we had spread the time out to about 6 months, but a 3-month dosing interval for the booster was also accepted, and it was rolled out with people across different provinces. Again, another slide that I've stolen from the Ontario Science Table, only because it just illustrates this in a nice graphic. Here we see the protection afforded by vaccination, and that was actually great up until mid-December. So the orange and yellow lines at the top indicate almost 100% protection against ICU and hospital admission from vaccination. This goes back to Delta. The purple line shows protection from symptomatic disease after vaccination, but this falls off precipitously right at the end of November when the emergence of Omicron happened. So this blue line over here, well, that shows when the Ontario government announced booster doses for anyone 18 years of age or over, and it coincides with a lot of other provinces who are opening up booster doses as well. I'm just using Ontario data over here, so I just want to reference that. The green line over here, this is when boosters started being administered, and then the resultant outcome for that is all of this recovery of protection by the third dose boosters. So we actually saw a lot of people get a lot of benefit from that. And if you still wanted some more information on the effectiveness of boosters, additional information from the US Centers for Disease Control show that the protection against Delta and Omicron from booster doses from the available mRNA vaccines. So despite Omicron evading some of the protection from vaccination with a 2-dose primary series, getting a booster dose really increases the protection to 90% against serious illness. So, at the end of the day, when it comes to protection needed for Omicron, this is a 3-dose vaccine. So if you want to have maximum protection, and if you don't have your booster, I hope this data convinces you that it really is a necessary component of full protection, not just for you, but also considering this for your employees and for your workforce. So beyond vaccines, though, additional evidence emerged from studies done with Omicron, and it showed that masking for Omicron could be improved. The evidence showed that cloth masks weren't very useful at all in preventing transmission from Omicron. And if you're still using cloth masks, I think it's time to rethink that strategy. In order to benefit from using a mask, you really had to wear a well-fitted medical grade mask at the very least, or better yet, if you had an N95 respirator in the workplace, whether that was a fit tested respirator or not, it seemed to offer a lot more protection because of the filtration, but also because of the fit. Now, this has some implication for employers who've had mandatory masking policies, in that at the very least, employees should be wearing medical grade masks when indoors. And honestly, the N95 respirators, they're actually very, very good, but they do pose some logistical hurdles in getting, workforces fit tested if you haven't done that already. So in the healthcare sector, most healthcare workers have already gone through fit testing of these respirators because it's part of their job. But if that's not necessarily part of your workforce's normal sort of approach to this, it can be a bit of a hurdle to get that all sorted out. So all this advice on masking certainly has helped. It's actually contributed to curtailing this, in addition to all the other preventative measures that we've seen. So, just a little bit more on the Omicron subvariant. So if you haven't heard about this, this is the new kid on the block. This is a subvariant. It's an offshoot of the Omicron variant of concern. As provinces move to drop most pandemic restrictions, it's a cautionary note that this subvariant, BA2, is gaining a foothold in Canada. We don't have widespread testing to actually know the accuracy of how much or how many or what percentage of cases is caused by this. But it is estimated in the public health circles that are doing testing in the different provinces that BA2 infections currently represent as much as over 90% of the cases currently in Alberta, about a third of the cases, new cases in Ontario, and about a quarter of the cases in British Columbia. Its virulence or severity compared to Omicron is not entirely understood, and full understanding of this and the implications may take several more weeks to get there. But public health officials continue to watch this closely to see if these preventative measures should be reconsidered in some jurisdictions. So when we're taking away masking and distancing and all these other preventative measures, we have this on the horizon that may cause a problem. The good news with this, if there's any good news with Omicron, there was a ton of people that unfortunately got exposed and infected, but they got away with without serious health outcomes and have generated a lot of immunity to it. So with the high rates of vaccination and with natural infection giving some immunity to people, we may not see a whole lot come of BA2, but it's certainly on the horizon, and we're watching this with caution. Whatever the case, though, we have some idea of what limits transmission, right? So in the effort to detect cases and prevent transmission, we're using a lot of different things. And one of those measures is rapid antigen testing. And the guidelines for use have changed. So I want to talk a little bit more about that right now. So rapid antigen tests are a very efficient way to test for COVID-19. And with the high transmission rates and high prevalence of Omicron in communities, these tests became most important in identifying people with infections and keeping them out of workplaces, thereby preventing spread. So because we were seeing so many high infections, public health labs were overwhelmed and couldn't do lab-based testings. And so we started relying on rapid antigen tests more than we had in the past. And that's actually shown to be a good thing. Antigen testing identifies people who are currently infected by detecting proteins, or the antigens, on the surface of the virus. It's a lateral flow assay. So what that means is that it's a type of test that runs a liquid sample along the surface with reactive molecules. It's the same technology that we've used in pregnancy tests and rapid strep tests. And it can be done by individuals themselves. So you can swab yourself and then conduct that test all by yourself. It's pretty quick. It takes about 15 to 20 minutes to get a result. And certainly it's been useful for diagnosis. In fact, that's how it was originally approved by Health Canada, but for a lot of provinces, when it was initially rolled out about a year ago, so we just used it for screening. So if we got a positive test, we had to go for a PCR test. The emerging evidence shows that this can be used for diagnosis, specifically because we've got such a high rate of infections in our communities. So this thing that we call a pre-test likelihood, the likelihood that you actually have this disease if you have symptoms, is pretty high. And so if you do a test and it comes out to be positive, we can rely on that pretty heavily and can take that to the bank. So the guidelines have changed, like I said. So I just want to sort of talk a little bit about this. The current public health guidance, because of the high prevalence of Omicron circulating in our communities, and because our labs are overwhelmed, if you have symptoms that are consistent with COVID, so certainly if you had a fever or cough, shortness of breath, if you've got a loss of smell or taste, and then if you've got a constellation of other symptoms like headaches or muscle aches, fatigue, gastrointestinal symptoms, if you've got a number of those symptoms, then we are going to automatically assume that you have COVID and you're going to have to isolate. But if you have some of these non-specific symptoms, like a headache or muscle aches, well, these could be related to other non-COVID viral infections. So prolonged isolation may not be necessary. And if you're thinking about you're staffing your workforce and to see how this sort of unfolds, there are some strategies that public health has recommended using rapid antigen tests, or RATs, that can assist workplaces to manage this potential absence in their workforce by using a test-based approach. So the guidance right now says, if you have a positive rapid antigen test, it does not require confirmation testing with PCR. So you can take that to the bank. And there's multiple use case scenarios as well. Guidance also suggests that testing asymptomatic employees routinely at least 3 times per week has been shown to be very effective. Testing more often at around 5 times per week is actually better for Omicron, but it does require an abundant supply of rapid antigen tests. It's noteworthy, some of this guidance came out that the one-off infrequent testing, such as we were using perhaps the end of 2020 before the holidays, when we were using a rapid antigen test before attending social gatherings, it's not recommended anymore because you can't derive a lot of good information from a single negative rapid antigen test. So a single negative test does not mean that you are not infected. And so that was one of the reasons that was walked back. Symptomatic testing has been approved, like I said earlier, by public health authorities because of the high prevalence of this disease in the community. If a test is positive, you can rely on this and you should isolate. If you have a negative test, You can repeat that test in 24 to 48 hours. And when you have this serial testing, you actually get some more information. If the repeat test is also negative, then it's not likely COVID. But the advice is that you should still isolate until symptoms resolve before going back to work. The next infographic really distills this advice to one slide. It's a bit of a busy slide, so I apologize in advance. And some provinces will have slightly different approaches, but this is a good general overview. And I've included this because if we're going to send out the slide deck, you can use this as a reference until the guidance changes, which is likely going to happen as well. So I stole this concept from Quebec. Quebec has a really good infographic on how to sort of manage it. Their advice is slightly different. What you see in front of you is very Ontario-centric, but it's actually consistent across a lot more provinces. So I've just chosen to put the Ontario information here. So individuals displaying symptoms of COVID. So what do you do if you have symptoms? Well, you can be cleared from isolation by 2 consecutive negative rapid antigen tests, separated by a minimum of 24 hours to a maximum of 48 hours. So in this case, if somebody has symptoms and you're not sure, could this be COVID or not? Should I be able to do other things? You do your first test. If that first test is positive, then you isolate right away. You isolate according to the period of isolation that is recommended, and that's dependent on your age and your vaccine status. If your first test is negative, though, and you're still symptomatic, certainly keep isolating and then do a second rapid antigen test at about 24 to 48 hours. If that second test is positive, again, you can take that to the bank, so you have to isolate according to the isolation requirements. But if that second test is negative, then you can actually resume your activities while continuing to follow public health measures. I will say if you still are symptomatic, it's probably not the best thing to go into work, but you get a better sense that you don't have COVID with 2 rapid antigen tests done serially. So irrespective of serial testing, though, individuals must be fever-free and they must have their symptoms improving for a minimum of 24 hours before discontinuing self-isolation. And like I said, similar approaches have been adopted in most provinces and territories. So I will refer you back to your local health authorities guidelines to find out if this particular approach is relevant to you where you are located. Following resumption of regular activities, though, if you get to leave isolation, you should continue to wear well-fitted masks or respirators and maintain physical distancing from others outside of your household whenever possible. Okay, so as a means to increase the accuracy of these rapid antigen tests with Omicron, there are studies that have emerged that have recommended the adoption of a different type of swabbing method. This is a combined oral nasal swabbing method. Now, swabbing or sampling from the anterior nares or the nostrils has been sort of a popular means of sample collection. It's less invasive than others, like the one from the back of the nose, that's sort of the brain tickler, or even from the throat sometimes that needs to have a trained healthcare practitioner conduct these samples. But with the rapid antigen tests, people were using the nasal samples, and it was working fine for Delta, but with Omicron, the accuracy of the sensitivity of these nasal-only samples was just about 68% or so, whereas the combined method, swabbing the cheeks and the back of the throat plus the nostrils, increased the accuracy of the sensitivity up to about 82%. And so public health has recommended that if you're doing rapid antigen tests, if you have a medical surveillance program at work, if you're doing this yourself, that you should adopt the new recommendation for combined oral nasal swabbing. This combination increases the sensitivity, but it takes a bit more time. It's a little bit more uncomfortable. If you're sticking a swab in the back of your throat, you can tend to gag, and it's not a pleasant feeling. The gagging tells you that it's in the right spots, but people don't like that. And so it may actually reduce the number of people who want to do or who volunteer to do rapid antigen testing. So at the end of the day, organizations will need to critically evaluate and weigh the pros and cons of the combined method if you have a rapid antigen surveillance program. If sampling the nostrils is an acceptable method, and it gets more people testing, maybe that's something that may sway your decision as to which way you want to go. So, all that being said, I just want to talk briefly mention a little bit more about some of the other considerations that may impact business approaches and managing the ongoing risk of infections with respect to rules and regulations. The provincial regulators have really not changed a whole lot of the requirements. They're still sort of evaluating the impact of Omicron, but because we don't have the availability of lab-based PCR testing as a practical way to confirm results, the provincial regulators, ministries of labor, and their equivalents in the different provinces may no longer be employers may no longer be required to confirm a suspected workplace cause with a PCR test. This means that the provincial regulators will typically use other tools if a case is suspected to originate from the workplace. So the advice to employers is really to use all the screening tools available and keep your records very detailed of who's working and where they're working if they happen to get infected and come down with an illness. In any investigation that occurs in this context, an employer's ability to document your actions will be key in meeting any regulatory requirements. With respect to workers' compensation boards, they've also aligned and removed the requirement for a PCR testing for a workers' compensation claim in most provinces. Again, check to see what your individual workers' compensation board rules and regs are, but generally speaking, they've removed the requirement for PCR testing. What this means is that employees may use rapid antigen test results or doctor's notes or any other means to verify that they had an infection that they think was acquired in the workplace. And workers' compensation boards have a regulation to determine causation. So it's the employee will have to provide the suitable references for them to make decisions. So that the advice to employers, again, just as it is for the provincial regulators, is to really keep detailed notes and documentation for any declared workplace infections. Public health authorities, they're still pretty overwhelmed with the Omicron surge, and so they've changed their testing and tracing approaches as well. They can't keep up with this, so it really falls to employers to do some of that contact tracing yourselves. Practically, local public health units can still enforce rules and practices depending on evolving risks, and they can declare outbreaks. They can't shut down, organizations that have an outbreak in there. So expect this to evolve over time. Expect testing rules and advice to change. This has been the only constant that we've had over the past 2 years. This stuff changes, some days each day and sometimes by the week. Hopefully we'll be in a position where things stabilize a little bit better over the next several weeks. And then the last bit on this slide, employers are also advised to get appropriate legal advice on vaccine and testing policies in the workplace. Ensure that you've got a reasonable approach when considering all of this, and consider whether or not any policies that you have really does enough to protect your workers. Employers are bound by provincial obligations under occupational health and safety regulations to protect workers and provide safe workplaces. So that should be the motivation for considering any of these policies. But you also have to consider human rights statutes, which require employment approaches to be free from discriminatory bias and flexible for accommodating workers under any protected grounds, such as medical exemptions. So you have to bake that into your policy. You have to be considerate for that. And then the last point is that if you're in a unionized workforce, you really have to consider what your collective agreements say with respect to mandating vaccines or testing. So certainly get your legal advice and your labor relations involved in deciding any of this, so that you can have a really fulsome approach to this. So, I'll just finish on a couple of final thoughts over here. We know where we want to end up. We want to get to the end of here. The end of the pandemic is when we get back to some sense of normalcy. And normalcy means not having restrictions on our movements or traveling or socializing. Perhaps there will be some, but we don't want to be encumbered by a lot of them. Not having our hospitals and our ICUs at or beyond capacity dealing with COVID cases, but able to respond to all other serious health issues that need attention. And then from a business operations perspective, it means servicing our clients, keeping our business running, being successful with our business endeavors while ensuring a healthy and safe work environment for our workers. So while we know what all of this looks like, we don't know when we're going to be able to get there. Maybe it's a month from now, maybe it's longer, maybe it's in a few weeks, but we do have a work back plan. So what we need to get to that sense of normalcy is that we need to achieve this thing called herd immunity. It may be sort of a stretch to think that we can do this, but herd immunity really occurs when a large proportion of a community is immune to disease, either through vaccination or through natural infection, so that any new infections that are introduced into the community are unlikely to spread like wildfire because there aren't that many susceptible people. As a result, the whole community is protected, not just the ones who are immune. So when we achieve this level, which we might be very close to, but when we achieve this level, we have low rates of transmission, infection, hospitalization, serious health outcomes, no significant outbreaks that disrupt our day-to-day. We may see some infections here and there, but the outcomes from these wouldn't tax our healthcare system. They wouldn't disrupt our freedom of movement. They wouldn't upend our economies and our workplaces. But to achieve this bliss, we've got to get more than 90% of all Canadians to be immune, whether it's vaccination or through natural infection. With the high rates of Omicron infection over the past several months, we may be there already. We just don't know that. But I will tell you that 90% need to be vaccinated. That's of the entire population, and we do know that there's a few select groups. Certainly kids under the age of 5 that haven't had vaccines approved for them, and certainly any vulnerable populations that vaccines are contraindicated. We can't actually do that. So we do have groups that we may not be able to achieve this 90%, but we aim to try to get as far as we can. For all the people of the population that can't or won't get immunized, employers can use rapid antigen testing. This is advantageous for a number of reasons. We can use this for symptomatic, we can use this for asymptomatic individuals. It gives us fast results. It's very useful if it's done frequently, 3 times a week, 5 times a week. It doesn't require specialized training and anyone can do it. And the ease and attractive cost of it make it ideal to use it frequently in large medical surveillance programs that employers can consider. We've also moved to at-home testing or do-it-yourself testing. It's the next iteration of this rapid antigen test. DriverCheck has some solutions for that, so certainly we're able to talk to employers about making that happen if that's something that you're interested in. I will say though, testing does not replace vaccination. It's used as an added measure to ensure workplace safety in populations that are not fully vaccinated. And then the last bit, all the mitigating measures, this is still required. Like the pandemic is not over. Have this thing, COVID is not over, and we need to continue to use all the existing public health measures despite provincial easing of these for the public. I will say, we shouldn't really remove these prematurely. Provinces are making claims that they're going to remove preventative measures, and that certainly might be a reasonable thing to do. They're following the science and they're making decisions that are affecting the general public. But I will point out that business operations and the risk to your business may be very different to the risks that individual citizens have, and so you have to put that into the whole risk assessment that you do for your organization. Our recommendation, or my recommendation, would be not to remove your public health measures like masking and distancing and capacity limits. It takes about 3 weeks for us to realize if easing a preventative measure was the right thing to do. We're taking a best guess. And so it takes a while for us to understand what's happening. So, the recommendation is to keep public health measures in place for at least 3 weeks after the provinces remove it from the public. This way you get to see what happens and then you can respond. You can be cautious in how you remove this one at a time. And please keep consideration of all the ongoing risks to your own business operation, despite what's happening in the public arena. So, I'll finish on this. Like, what is the new normal? Like, I think we've been living with COVID for the past 2 years. I don't think this is something new. I've heard this thing that we've got to start living with COVID. I think we've been doing this already. While while outbreaks may occur, we know better what to do, and we need to take quick action to implement and execute these measures. Pandemic closure is better understood as occurring with the resumption of social life, not by achieving some specific epidemiological target. We talk about endemic, and what does that mean? Well, endemic does not mean that this will be mild in any regard. For example, malaria and TB are endemic, and they kill hundreds of thousands of people each year. So we shouldn't confuse something that is endemic and sort of stable with being mild. So I just want to sort of remind people that's a different sort of focus on what we are able to tolerate with disease and death. For employers, though, I think we need to learn from all the lessons that have gone before us. Have a pandemic plan. Stand these pandemic plans up quickly if you've eased them off to prevent bad outcomes, not only for individual workers, but also for business operations. Understand that pandemics are not going to go away because a politician declares it over, or and we can't certainly wish them away by honking horns. We need to be sensible. We need to be cautious in our ongoing approach to mitigate this risk for some time longer. So keep in mind, vaccinate and boost quickly, test and trace. That may fall to you to do that as an organization. Go back to masking in high-risk situations if that is warranted. Reduce capacity limits. Keep up with physical distancing if necessary. And certainly don't forget about ventilation. Ventilation is sort of the thing that has been in the shadows for a long time. We really need to keep our spaces well ventilated. And now, with the new treatments on the horizon, we do have a way out of this pandemic, and hopefully we will get there soon. So I'm going to stop there. I'm just mindful of time. I'll turn this over back to Jeremy, and I'm happy to take any questions that you might have over here.
Great. That was awesome, Jonathan. Thanks so much. And some folks, again, as we've been following along the pandemic, information changes continuously. It's a very rapid evolving scene. And so thank you to Jonathan for staying on top of this. Just a few weeks ago, I remember we had the discussion about the swabbing of the cheek versus the swabbing of the nose. And I just don't get the order mixed up is what I always joke about, but just seeing how quickly things change. So a couple questions have come in during the webinar, Jonathan. And then also before, during the registration process and our promotion of the event, we welcomed questions to come in. So we have some already set up. So and again, if we don't get to all the questions today, Jonathan and I will regroup post-event. We'll come up with some commentary for your questions, and we'll make sure that we circulate that to everyone in attendance. Okay, so the first question to ask Jonathan, if able to operationalize, do you see a benefit for companies to consider or adopt a hybrid schedule of working from home and in the office? And the example they give is decreased number of people in the workplace at one time.
Yeah, I think it depends on what you do. Obviously, if you're on a production line, you don't have the luxury of working from home. You have to be on site and you have to do that. But certainly, if you have the operational capacity to allow some flexibility in workers working remotely versus coming into the office, I think it'd be wise to consider this. I think that the past 2 years have shown that we don't tend to lose a lot of productivity when people are working remotely, and people really appreciate the autonomy of controlling some aspect of their life that they don't have to do the commute. They can sort of use that extra time to do whatever they need to. So I think employers who are open to this flexibility and allowing people to work remotely and come into the office in a hybrid scenario are actually going to do well from a recruitment and retention perspective. But more importantly, I think the question is really how is this going to impact public health measures? And I think that, if the more we do know, crowded closed spaces are a higher risk. So if you can lessen the crowds, if you can open up the spaces, you can improve the ventilation, I think you're going to be a lot better prepared to deal with respiratory infections like any of the variants that might pop up at some future state. So yes, I think certainly if you can operationalize that, please consider that seriously, because it's certainly going to be helpful on a number of different fronts.
Okay, thank you. So we had a couple different questions, just asked differently because they're obviously different people, but it's around masking and provincial regulations. So I'm going to kind of intertwine the two, Jonathan. So what is your advice to employers on masking for indoor workplaces? And you touched on this a bit with the ventilation, but for indoor workplaces as the province begins to lift its mandates in the next few weeks?
Yeah, so I touched on this in the talk. So politicians are removing a lot of mandates provincially because they have to be in tune with the needs of the public. So they're not necessarily focused in on business operations or employers' needs in the workplace. They're talking about public. So public going into restaurants, bars, and sort of carrying on with their lives. Those restrictions don't bear the same risk that you might have in your workplace. And so the recommendation is we still have high caseloads. Just because things are tailing off with Omicron doesn't mean that COVID is over. We still have this; it's still circulating in our communities. There is an potential emerging risk with a new subvariant. I think it's really wise to not remove masking indoors in workplaces, but it also depends on a number of other factors, and I think you have to consider them in totality. So you might be in a region where the community spread is pretty low and you've got a lot of hospital capacity to allow, if people get sick, that they can go in there and it's not going to overwhelm them. But you also have to consider if you remove a mask mandate and you have workers coming in, if there is spread out in the community and somebody brings it in and then it infects a number of workers, so much so that they all have to be off work, you're going to lose a big chunk of your labor force. If you've got restrictions in how many people, sort of a minimum cohort of individuals working in a safety sensitive or safety critical area, you might need to have 5 or 6 individuals working in that location. If they all get sick, then it effectively shuts down your business operations. So you really have to do a risk assessment based on what's happening out in the community spread, the risk of transmission, your hospital capacity, and your own individual workplace risk. You're asking a doctor, in my opinion, and it's always a conservative approach. It's always to say, you be the second mouse to the cheese. The province lifts up the restrictions, see what happens, and wait 3 weeks. It takes 3 weeks for us to actually know what's going on. If you can maintain those mandates for an additional 3 weeks, and it proves itself that the risk is low, we haven't seen a whole lot of resurgence with it, then you can actually remove those restrictions a little bit later on. But be prepared that when you do that, it's not a fire and forget decision. You don't make that decision and walk away. You revisit that. You get together with all the people that necessarily need to make the decisions, your operations, your health and safety, your occupational health teams, to say that if you are seeing a resurgence, then you put those protective measures back in place pretty quickly. You have to act quickly because we don't have a lot of time to make mistakes.
Okay, thank you. So to pull on that a little bit further, what's your guidance or advice when you compare N95 masks versus medical 3-ply masks?
Yeah, great question. So masks, the studies have just come out recently. They certainly support, much better filtration as being more protective. The N95s have a really good filtration system. The medical masks also have a good filtration system. The difference is that the N95 respirators have a much better fit. They have, especially if you have a seal tested respirator, they fit around the nose and mouth so that they've got a really good seal and they really filter things. If you're in a high-risk situation, having if you're a healthcare worker, if you're dealing a lot with COVID patients, for example, we've got a number of our staff who are out there dealing with suspected COVID positivity. They're doing testing, doing vaccinations. So, in those circumstances, it makes very good sense to use, fit-tested N95. In other circumstances where the risk is not that high, but high enough, we do know that the medical grade masks are actually a pretty good alternative. So depending on what you're actually doing in your workplace, a medical grade mask is the least that you should be providing. I would stay away from cloth masks. They're more fashionable for sure, but they're not doing a whole lot for protecting you from a respiratory perspective. So at very minimum, give your workers a medical grade mask. Even if you can provide them with a N95, even better.
Okay, great. And then we touch on the air purifiers. Like, what about these purifiers for an indoor space? How is that going to help with mitigating the risk of an infection? And I'm sure there's, ones from your retail store that you can get at Walmart or Amazon versus ones that you need to go a little bit more commercial. So can you touch on that a bit?
Yeah, so ventilation, like I said, it's been a largely ignored preventative measure. I think it's really important. As soon as we started getting some information that SARS-CoV-2 was sort of lingering in the air and aerosolization, and there was some degree of airborne transmission. But by the way, there is some airborne transmission, but most of the transmission happens with respiratory droplets. So it's not either or, it's a continuum. But as soon as we got that information, we realized that ventilation was going to be really, really important. Now, the problem with ventilation is that a lot of facilities already have these ventilation things built in. It's very costly to change and move things. So, it becomes an impractical consideration for a lot of people to re-engineer their buildings. And so they start bringing in, particle filters, high efficiency particle air filters, HEPA filters, for that space. The problem, and they work really, really well. However, you have to have the right size for the space. You can't get a little desktop HEPA filter for a large room. So you really have to put the time and effort into finding out what is the most suitable HEPA filter for that space. And if you do that, then I think it does improve outcomes. So every little measure helps. Like I said initially, that Swiss cheese model, if you've got that ventilation, if you've got the masking, if you've got distancing, all of that, and have vaccinations in there, all of that really helps cut down on the risk that your employees will face.
Okay, thank you. So the next couple of questions here, Jonathan, and again, just being mindful of time, it's more around how do we, well, I'll start with the first one. It's how do we deal with employee apathy surrounding COVID-19 and the associated safety protocols? So people are tired of dealing with this. They just want to get back onto normalcy. Any advice on how companies can work with that?
I don't know if I have the magic answer for this. I think at the end of the day, what we have been seeing and how people's behavior and conduct is affected really depends on a level of trust. So if you have a good trusting relationship with your employees, if you're transparent and go over rationale for why things are, you get a much better buy-in from them. The problem with that is that you have to have established trust well before a crisis occurs. And so, that plays a big part of it. So if you have a trusting workforce, if you've been transparent, if you've sort of engaged them in sort of decision-making, you'll tend to have better outcomes. If you're already there, if there's apathy over there and people are not too interested, or they're just tired of it, the next best option is to try to establish that trust now. Is to try to get the communication out, communicate, over communicate what you need to do. Give people rationale for why this is. People will sort of go along most people will go along if there's a reasonable explanation for why things are. And we get into a problem with employers dictating what happens without people knowing why things are changing. So give people rationale on why things are happening. If you're in a unionized workforce, have collaborative discussions with your union members. They can get their membership to align with sort of approaches. At the end of the day, you're all very interested in protecting workers, which is really the point of this all. So engage the people, have them part of the decision making, roll this out, be mindful of communication. Those are sort of general measures. I'm not sure how successful it's going to be one organization to the other, but that's what I'd recommend.
Okay, which this is leads nicely to the next question. So how have you stayed healthy physically and mentally throughout the pandemic?
Yeah, it's a good question. It's a good question. Have I? Yeah, I think I have. I think I have. It helps being in this profession, Jeremy, because I think that I'm able to manage my expectations. When this first hit in March 2020, quick analysis, I knew that this was going to be at least about a year and a half. I knew it was going to be about 18 months or so before we were going to get free and clear. And so, my expectations of how the year was going to unfold certainly helped keep me sane. I knew what we were up against. I was hoping for better outcomes at the end of last year, but then Omicron showed up and sort of threw a wrench in our plans. So I think, managing your expectations with, managing my expectations with how things unfolded was helpful to me with keeping my mental health in check. I've also got a good support system close to me. So even though we're locked away and working remotely, spending time with my family has been helpful. The physical part of it, that's been hard. It's the wintertime. It's hard to get out. I have a dog who hasn't barked, thank goodness for that. But we take him out on lots of walks, and I think that helps to get out and get some of the fresh air. It's sort of you keep your distance and you can keep outdoors, so that's always helpful. But yeah, I'm hoping that the better weather improves opportunities for getting out there and keeping active and fit.
Yeah, so I'm going to add a little bit to this. So I've done different videos before, recording. Some people may have seen them, where I talk about my battles with stress and anxiety. And my father passed away actually a year ago, just over a year ago, and I was just a complete emotional wreck. And so what I was able to do as I've overcome these challenges is I've really dedicated to lifestyle changes. So not going on fad diets or things like that. So I make a conscious effort. When you talk about going for those walks, Jonathan, I do something for myself every single day. And that could be a brisk 15-20-minute walk. I don't care how cold it is, because that fresh air does wonders for me. This is why I have the Zen garden behind me. I exercise frequently. I am very, very mindful of what I put into my body, because I was finding the wrong foods would also make me ill or make me sick or trigger different emotions in my body. So I've really become more in tuned. And then things like yoga and meditation. I never used to believe in that sort of stuff. I thought it was cool if you could put your legs behind your head, but I never put it into a practice. But I'm sleeping better now, because it's a way to really calm me down and really put an attention to where my energy is going. So really, like, I would encourage people to find out, like, what are your triggers? What makes you frustrated? What makes you angry? What makes you emotional, sad? And once you can really understand where you're spending your time and energy on those things, you can start to find outlets. So some people might not be exercise junkies like me, but they might love a good book by a cozy fireplace. So it's really finding out what makes you feel great and really kind of disconnects from those stresses and anxieties that we deal with. So.
Yeah, no, and I appreciate your Zen garden behind you, and I think meditation is a great way to do it. I've been recommending that to a few people who perhaps are not ready for it, but if and when you are, I think it really helps. It gives you a sense of calmness. It settles down things that might be problematic, and it gives you, I think, a much better sense of self-awareness as well. So that helps.
So that was a fast hour, I must say. Do we have time for one more question, Jonathan?
Sure. Yeah.
Okay, great. So, and again, all the questions that we didn't get to today, we still will respond with a written answer. So I'll go with this question here. Do unvaccinated individuals pass the viral load on more than those who are vaccinated?
Yeah, great question. The answer is yes. So if you're unvaccinated, you tend to have a higher viral load, so a lot more virus, and you tend to be infectious for about 10 days. So, high viral load, lots of infectious, you're spreading this, like you're a super spreader yourself, specifically with Omicron. If you're vaccinated, you tend to have a much lower viral load, and you tend to be infectious for about 1 to 2 days. So a vast difference, about 5-fold difference, unvaccinated spread versus vaccinated spread.
Okay, awesome. And I lied, I'm gonna ask one more question. So rumors spread very quickly that you chose the music pre-webinar. They're wondering if you're available for parties, events, and weddings.
Yeah, no, I'm not. It's just fun.
And I just made that up. I just love to entertain myself. So trying to make Jonathan blush. So no, that was very informative, Jonathan. Always enjoy these conversations. I love the insight that you can provide and giving us direction. And again, so we will share a recording of the webinar, hopefully by tomorrow. We'll send that out, and we're going to include a short survey. And what we want to hear from the audience is like, well, first off, did you enjoy it? Did you learn anything new? But what about other future webinars? What are topics that people want to hear about? Because DriverCheck always strives to be the educational leaders in fitness for duty, which is so encompassing of so many different things. But really, we want to hear from our clients and our audience, like what's important to you. And with all the resources that we have access to, like the Jonathans of the world, or people know Dr. Melissa Snyder-Adler, we have so many resources that we'd like to be able to share with whatever's important to what people want to learn. So, okay, great. Well, I hope everyone enjoys the rest of their day, and hopefully we'll see you. We're got something in pencil for next month for March 30th. It's in pencil, but a communication should be coming out soon to verify what that topic is going to be. So again, that's why we're so interested in what everyone who's attending wants to hear as we map out the rest of the year for webinars. So, okay, with that, enjoy your day, everyone. Take care, and thanks, Jonathan.
Everyone.